instrument mat. You guys see them on the videos?
Mm-hmm.
Because so that nothing will fall off the field.
Did we put any clamps on the field?
No, I think it's still one of those bags.
So, okay, so you guys, you have the list. Well, I'm going to be on that side. She's going to be the ST. We're just going to run the case. Off what you guys tell me what I need. Here's your blade. Here. And here's your platoon and your finishing. Here. Okay? Okay. So, timeout. We're doing a. Who wants to do the timeout?
We've got John Doe in for a thoracotomy, lobectomy, no drum nowadays. Everyone agree?
Okay. All right. So, who's gonna read it off?
I'll do incision is made into the fourth intercostal space.
There's a couple of laps.
To make for the right middle lobe and lower lobe dissection.
So that's done. Okay.
A rib spreader is placed and the pleura is incised.
More than likely, they're going to do some bolting, right? To kind of stop the bleeding and stuff like that. So what's the next
A
step?
rib spreader is placed and the pleura is incised. Is that this rib spreader?
Are you still going through muscles?
Yeah, well, it should be going, probably will be going through some muscles first, right? Then the rib spreader. So we can't really put it in, so let me see it, but I want to show you guys. On this one here, let me show you how this works. So this is really, really important. This retractor has blades, and you have to hold them. So on your tray, you might get some that have shorter blades and some that get longer. You want to make sure when you're putting these on that they're put in the right direction. If they're going spread open like that, they should be in this direction, right? Because it's going, see how this going this way? They would not be going in like that. You have to make sure that the smooth part is going against the tissue. Does that make sense? So then this opens up here, put them in, and you make sure it's click, and there's a lever here. You have to push all the way up, and that sort of locks it in place, and then you have to twist it tight. The thing about this and any other instrument that has extra attachments, you have to make sure that you have it on right. When you're counting this instrument, because you will be counting instruments on this open thoracotomy, you have to also count the retractors, and you're going to count the blades, and you're going to count the nuts. Because you have to make sure when you pass this off, you get these back. Because they can actually then slip off, and then they can stay inside the patient. So this goes in. Put this in. What is the next step now after this?
The fissure between the upper and lower lobes is open, and dissection of the pulmonary artery is begun.
So let me have a long debate and some methadone scissors. And I do have a scissors right here. I'm doing that. Okay.
Pulmonary artery and pulmonary vein lobar branches are identified, isolated, double ligated, and
So let me
divided.
have a right angle. And I'll need some kind of tie. Do you have any ties up at all? Or any kind of suture?
No.
I have
I can get you a towel pack.
just some, I need some silk.
All right. One or two?
What is there? So the first artery we are looking, the first
This
vessel
one's
we're
the
looking for is what?
Pulmonary artery.
Just cut the needle off of it and just put it on like a passer or something.
You need a backup?
Yeah, one more.
This would be plus 2 to the top. See, you know, from your basement.
identify the
Sorry,
pulmonary
Denise, that was
artery,
me.
right? You saw in the video. Let me just have the, I'm gonna put it through here, right? I'm gonna tie it. That gets tied,
You said you wanted another
and
one?
then I'll tie it up. Then I'll take the suture scissors, and then the next vessel is what?
Pulmonary vein.
Pulmonary vein, same process, right? So basically what you're gonna be passing me, if I'm dissecting the vessels, you're gonna be passing me right angles, ties, stuff like that. Okay, just be ready for that. Okay, what is the next step?
The upper lobe bronchus is freed by blunt dissection and a bronchus clamp or staple gun is placed at 1.5 to 2 centimeters from the main bronchial
So
trunk.
I'm gonna blunt dissection, it could be my finger, it could be the back of a DeBakey, kind of like, just kind of pulling back. And then I'm gonna need the clamp, so I clamped it, and then once I clamp it, I will either, I'm going to either use, I could clamp it with this, I could use also the other device, which is the what? Here's TA. And then one of them actually use a small GI, so stapling device or whatever. But in this case, I'm gonna clamp it because we don't have one. So after I clamp it, what do I do?
The bronchus is divided and closed with non-absorbable sutures or staples fired from auto sutures.
Okay, so let me have, I'm gonna go ahead and cut, because all I did was clamp it, I haven't cut it. So let me have the long knife now. Take that, okay. Let me have a Billions here. One clamp. So let's just pretend this is we're gonna pretend this is the actual lobe. I'm going to cut it out. Right. And I need a stitch. Just give me anything. Okay, keep going. Let me have the turkeys.
A pleural flap is placed over the bronchial stump and secured with sutures.
Okay, so I did that. So I did the stump.
The remaining lobes are checked for leaks and the wound is closed after placement of chest tube across space and brought out through a skin incision through the lateral chest wall and connected to a closed drain system.
Okay, so let me have the skin knife. She has a tube then?
I put her a tube and a guide.
And let me have a oh, you put a guide? Okay.
It's right there, it's a guide and a tube.
So
That
let me
straight
have
long pipe there.
Oh.
There you go.
It goes out like this. Sometimes they don't have this, especially in the orange, sometimes they don't use it. But this goes through here, this goes through the chest. Right? And that goes out. Then I need, let me have the stitch, like something for the skin to suture that down with. I'm sorry, you keep reading.
Bailey rib approximator is placed and
Oh yeah, I'm not there yet.
Oh,
I'm, not
okay.
there. I'm still putting in the,
That was it for that one.
okay. I'm putting the stitches in for the, to tie in the, chest tube to secure them. I did that. Okay. And then I could remove now this retractor. And then I'm gonna now close. So I'll give that to you. So what I need now is the,
Bailey rib approximator.
This one?
and I'll approximate the ribs. Like that. And the next thing is,
A heavy chromic or Vicol suture are placed in the intercostals.
and those are those running ones. Oh, these ones? Yeah. I mean, they wouldn't use that one, you would use a micro, but I just wanted to show you that you use a pop-ups. Okay. So go ahead and just give me a couple of those, kind of show you how that would work.
You just
Take out the thing, take out the whole thing. That cover comes off, pull it off. Okay, give me like something like, some forceps or something. Load another one. I'm trying to show you how this goes. So it sort of kind of runs like this, you guys. So once I put the last one in, then I'll suture.
You want another one?
So that's it for that, and then we're gonna tie them. All.
And that's for your pericostal suture?
And what do you need? Let's close them. Normally how that's how they normally do it, and they do it all at the same time. It's just more efficient, it's faster. Wait, and then what I need now?
Chest tubes are secured with heavy silk suture to the skin.
Yeah, I already did that though.
Okay, wound is closed with real Vicryl and staples.
So then we just close, regular closing.
So would you start your count would she start her count when you're fixing the tubes? Suturing them to the
As soon
skin?
as, whatever, the best way to know when to count is when, as soon as I start closing.
Okay, regardless.
Cause
So
they'll
is that
irrigate, they'll do
pericostal
some
stitch?
irrigation, and they'll, make sure that they don't have any bleeders. They're gonna be doing cleanup as well. As soon as they say stitch, that's when you count. You don't just start counting, because you don't know if they're really actually done yet. So that, to me, that would be my, the best way to ensure that you're counting at the proper time would be as soon as they start.
So as soon as you give them that pop-off stitch, start your count.
Any questions?
What do you close the muscles with, or do you, I forget?
This is huge.
That's actually a V.
Oh,
It's a wasp or something.
Oh,
Can you go ahead and cut the camera off?